to assess the government responses to COVID-19 in the Asia-Pacific region using a gender and human rights lens.
So we looked at how far these measures impacted informal workers and how they expanded access to affordable healthcare and social protection, also those impacted by violence. So if I had to describe our key findings, I would say there has been a strong social protection response, a fiscal response to the COVID-19 pandemic in the Asia Pacific, but there's been a much weaker response in other key areas such as non-COVID healthcare, women's economic empowerment.
So the current crisis, for example, has really changed to an extent societal perceptions of care workers and caregivers, many of whom are classified as essential workers and are disproportionately women. The extent to which national economies actually rely on women's unpaid and underpaid care work has actually become blatantly apparent. And now there is an opportunity, based on the lessons learned from COVID-19, on how to rebuild a care-centered economy to value and care for all, not just a few. So a lot of people have been talking about building back better during, in the wake of COVID-19. At this juncture, renewing the social contract is really, really crucial between governments and people. It is important to rebuild trust and solidarity. And this requires appropriate investments in both people and the planet, and that entails ensuring that women and girls, roughly half the population, are not left out of decision-making that deeply impact their lives.
So if I could make a single recommendation for countries to build on their fiscal responses to the pandemic, it would be to prioritise the collection of data on women, men, girls and boys and groups facing persistent and multiple forms of discrimination also. This is key. To have this data is key for having evidence-based policy making and for putting gender equality and human rights at the centre of recovery efforts.